Morning. I wanted to kind of talk through the specifics around, what's the need behind, measurement for your employed provider network and potential leakage coming out of that network. The elements of really what's the problem or the identification is we've found a lot of organizations have great internal metrics from their, electronic medical record of patient referrals within the system. Where the issue lies is when patients are going outside the system, and how do we begin to, measure where those patients are going, the structure of ultimately how they're getting there, and which specialist they may be going to outside the network, and is there opportunity to, increase network integrity, patient retention within the system, those types of elements really being a big driver, with obviously revenue growth and patient retention being the ultimate goals of how do we kind of solve this problem that we're dealing with as a broad organization. The data acquisition aspect of that process, really being specific, what we find as HSG, there's a few ways to think about it. One, some organizations like to utilize their internal EMR data because there's lots of patient detail. Other organizations, especially when they get into the aspects of outpatient and, you know, patient leakage outside the system, we recommend a claims-based approach. So, let's leverage outpatient claims data sets and professional claims. Broadly, there's going to be, pros and cons to each. There might not be the same level of granularity and data coverage, but we're going to have access into, what we need some outpatient claims to kind of comprehensively evaluate not just patients going to our healthcare system, but patients going outside of the healthcare system as well. What HSG finds from a data acquisition process is kind of best is being able to, data transformation process is then being able to go through the elements of, kind of visualizing and simplifying claims data to be very actionable, both at the practice, provider, individual provider relationship and or overall network level to be able to kind of be applicable. So a few samples of what that potentially looks like from the HSG perspective is we like to use our HSG dashboard environment. We think is great from a delivery and packaging standpoint, but being able to, look at individual workbooks. One that we like to use and leverage is within what we call kind of our, strategic growth analytics would be an element around patient leakage, or if we actually go to some of our other samples around our claims data solutions, we can look at our patient flow component, which is going to be a way to measure patient relationships. And this is the transformation side of data. So let's look at patients that have an office-based visit with one of our employed PCPs. That's the network integrity piece we're looking at structurally here. And let's understand if those patients go to a cardiologist within the next 90 days, dark red being they're going to an employed cardiologist. If they were a light red, like we can see for women's health or other specialties, they're maybe going to a specialist on our staff but not employed. Then lastly, what's going outside the network entirely. When we talk about the professional service application of this, we recommend having ongoing measurement and discussions around these with organizations. So let's update data sets quarterly, but then let's be able to have structured discussions at the network level, the potentially, depending on how your organization is structured, either the service line individually and or practice level. So let's be able to have individual, discussions around practices and overall performance, and even down to individual provider, kind of structured discussions based on how you want to work through things. We like to bucket everything into kind of three main elements of discussion. One is our patients going outside the system for maybe three reasons we find most common. Operational factors, things such as, hard to get in, access structure, being able to, we call your front office, it's very challenging to find time within the books, very operational type things. We also find what we call provider level factors, which are physician and provider relationships that just happen to exist within the marketplace. Then the last are going to be patient factors, things like drive time, how long does it take to get in, back to access a little bit. Our insurance isn't covered within your organization. So those sometimes being more patient level factors as well. From a packaging standpoint, HSG recommends doing something like this as a recurring element. So once we establish which measurement we're focused on around patient leakage, especially from our employed group, let's have a baseline metric, and then quarterly, like I said before, let's think about how we layer that into our performance and track progress over time, so that we have the ability to both measure and then manage to that measurement tool. Other elements to think about bundling or kind of adding in are going to be elements around provider productivity access. What's the need within the marketplace from a demand standpoint for specific specialties? Are there other access-based metrics that you might have internally that you want to layer in? So there might be a number of different metrics that you kind of want to comprehensively evaluate as you think about keeping patients within the system. From a delivery standpoint, HSG definitely recommends this being an ongoing measurement capability. As shown, we like to publish things through our HSG dashboard environment for ongoing utilization. It enables us to, one, either kind of broadly look at performance and dig into very specific details as we just were. So if we go back to that solution we were just in, we can see, let's not just look at overall performance where we were, but let's maybe look at also where are patients specifically going. So let's identify which medical or radiation oncologists are those patients actually going to within that time frame that we're measuring, so that we can track specific provider to provider relationships and do this in an ongoing fashion. Typically anywhere from 1, 3, 5-year partnerships are what we recommend to make sure we're tracking overall progress within the system. Then from an implementation and monitoring standpoint, sometimes depending on the organization, it gets into a lot of business development liaison discussions where we want to have very targeted discussions. So we can go to individual practices that we employ. Let's identify what opportunities exist. So if we're going to this primary care practice B, we might not want to spend our time and energy talking about GI, general surgery, urology. It might be more worthwhile to, in return on our investment, to talk through orthopedics and ENT from a relationship standpoint, because there's a greater opportunity to bring more patients in the system. So the implementation side is a little bit more boots on the ground, like let's get into the nitty gritty and talk through very, once again, operational things, provider-based relationship things, and or patient factors that may be impacting our ability to keep patients within the system overall.